Hello, everyone. I'm Dr. Eric Augustson. I'm the Vice President of Programs at Global Action, and I am quite excited to be hearing today's presentation from Asana and her team. Before we start, though, I do need to make an important announcement, and that is that in reviewing Global Action's 2025 budget and our 2025 to 27 strategic plan, leadership determined that we were going to have to make some modifications within the organization. One of the big adjustments that had to be made includes having to reduce some staff. And sadly, Ida's position was one of those that was identified as we would have to eliminate. As you all know, Ida has been a wonderful leader in this space and has really driven the formation of a strong network between the researchers and a very strong portfolio. We are, as an organization, extremely grateful for her work. And I know that Ida, if she hasn't already, is very interested in connecting with you all. And if you don't have her email address, her LinkedIn profile is a very good way to get in touch with her. Now, that having been said, I do want to make clear that Global Action continues to be committed to supporting health economics research and to follow up in the legacy of what Ida has built. So I want to introduce you to somebody from also on my team. This is Dr. Cole Burbidge. Cole will now be the leader of our health economics portfolio, and he will be reaching out to all the current grantees sometime within the next few weeks to begin to get to know you a little more. And we are, like I said, continue to be quite committed to funding health economics research, and both through our general submission of research, and then we're also hoping that we will have a specific health economics request for proposals that will come out sometime within the next few months. Can't guarantee that will happen, but I am hopeful because we really want to make sure we maintain our strong support for this body of work. So with that having been said, I'm going to turn it over to Professor Kenkel to begin what I think will be an extremely interesting presentation. Thank you.
Good morning, everyone. Thank you, Eric, for that introduction. I just wanted to mention or just confirm, as you said, what an important role IDA has played, and I'm glad to hear that the health economics and global action will continue to be working together. And today is a great example. Very much looking forward to the presentation. The presentation will start with Professor Asina Kainer. She is a professor at the TOBB at the University of Economics and Technology in Ankara, Turkey, where she conducts research on applied microeconomics, applied microeconometrics. And over the past year or two, I'm not exactly sure when she began, she's began a very interesting research agenda in, broadly speaking, what I call the economics of tobacco harm reduction. So without further ado, I'll turn it over to Asina and let her make her presentation and then present the other members of her team.
Thank you very much, dear Eric and dear Donald. It's a pleasure to be here at this webinar. We will be sharing our research findings with you today on the economics of tobacco harm reduction in Türkiye. So I'm associated with Economic Research Agenda Association, which is the grantee organization for this project. Okay. This slide presents the disclosure statement to acknowledge the support from Global Action to End Smoking. Moving forward, I'm going to briefly say a few things about the tobacco control policy environment in Türkiye and our research, and then I will give the floor to my colleagues to make their presentations today. So Turkey was one of the first countries to adopt all of the WHO's tobacco control measures, known as the Empower package. A lot of work has been done on tobacco control in the country, including banning smoking in public places, sales restrictions, restrictions on promotion and advertising, and taxation. Looking at the more recent developments in the policy environment, we see the ban on menthol cigarettes and other flavored tobacco products, the adaptation of plain packaging, and intensified health warnings and graphic and text warnings starting from January 2020. And as of February 2020, Turkey banned imports of all tobacco harm reduction products, including e-cigarettes and heated tobacco products. An exception was made to this ban for personal imports, allowing the device, along with cartridges and solutions up to a certain level, to be brought together with the person. Given this background, it is quite striking to see that smoking prevalence rate in our country has not been decreasing over time. Here we see the prevalence rates of daily and regular smokers in Turkey in different years, different recent years. The most recent nationwide survey conducted by TEPAV in year 2022 shows us that 31% of adult population were smokers. And we have descriptive statistics from Health Research Survey from year 2022. As you can see, the smoking prevalence is quite high for both men and women. And we also have statistics for vaping prevalence. Combining daily and occasional use, we see that the prevalence is about 2% for men and about 1% for women. So what we see for our country is that the bans combined with non-compliance and weak enforcement of regulations have led to the emergence of illicit markets for tobacco products. And this includes alternative tobacco products, as well as menthol cigarettes and other flavored tobacco products, and roll-your-own cigarettes. So our research focuses on the analysis of the illicit market for tobacco products in Turkey. So today we have two studies to present. The first one will be about a survey experiment to causally examine the effect of legal status of a product. And the other one will be a discrete choice experiment, DCE study, to analyze the trade-offs consumers face when choosing among different tobacco products. So without much further ado, I'd like to leave the floor to my colleagues today.
Hello everyone. I'm Belgi Turan. I am also from the Economic Research Agenda Association and also from Top University. I will be presenting our first paper. It's a survey experiment, and in this paper we are looking at the effect of legal status of the products, nicotine products, on consumers' perceptions and choices. I also have the same disclaimer. As you know, curbing the consumption of tobacco-related products is a significant aspect of all international agreements. However, despite all these global efforts, smoking prevalence is really high. According to the recent estimates, it's 1.3 billion tobacco users worldwide, and if they don't quit, half of them are facing the risk of tobacco-related illnesses. In Turkey, the situation is even worse. As Asena Hocam told you, it's about 30%. 1 in 3 adults are currently smokers in Turkey. So it means there is still an urgent need to explore the effective strategies for decreasing smoking prevalence. At this point, non-combustible products, as we all know, offer a harm reduction alternative to traditional smoking. However, many countries, including Turkey, are implementing bans and restrictions on these e-cigarettes, despite the fact that there is evidence that they are less risky than traditional cigarettes. Despite these bans, there's a thriving illicit market for these e-cigarettes in Turkey. Because as Asena Hocam presented it, the production and sale is illegal in Turkey, but personal use is allowed. So it creates this illicit market. There is no ban on conventional cigarettes, but flavored cigarettes and roll your own cigarettes are also sold under the counter in Turkey. So at this point, our question is whether the perception of these products being legal or illegal is influencing the consumer behavior, particularly among young adults. We think that by signaling that these products are risky in terms of health and less socially acceptable, might influence consumers' perception. There is some literature on the bans and legal status of various products, on mental products, legalization of cannabis, also anti-smoking ads, bans of the anti-smoking, industry-sponsored anti-smoking ads, restrictions on e-cigarette use. There is a literature on that. But to the best of our knowledge, there are no studies comparing the effect of bans and no ban situations for cigarettes and e-cigarettes at the same time. So in this paper, we are trying to address this gap. We are looking at the effect of legal status on consumer attitudes, and we are doing this for both combustible and non-combustible nicotine products. We use a scenario-based survey method, and we focus on young adults in Turkey. To give you a preview of our results, we show that legality of the product rather than its type is significantly influencing the product's perceived health risk and also social acceptability. So we think that these results provide important insights for policymakers. So I'm not going to spend much time on the tobacco control regulations in Turkey because Asena Hocam have already presented that, but I want to underline some highlights. The production and import of the heated tobacco products are banned, but personal use is legal. Also, roll your own cigarettes and flavored cigarettes are also illegal in Turkey. So let me tell you briefly about our data. We conducted an online questionnaire. Participants were randomly selected, and we made sure that it's representative in terms of age, region, and gender. As I mentioned, we focused on young adults because we know that these products, e-cigarettes, are mostly prevalent among young adults in Turkey and in elsewhere. And then also it's the time where individuals are starting to use these products and they are experimenting. So it is the most reachable, if I can say, age period of those individuals. We are focusing on conventional cigarettes and also non-combustible products. On the conventional parts, we don't distinguish between factory made or hand rolled. So if either one is used, we define the individual as a smoker of conventional cigarettes. And for the non-combustible products, we include all these products you see in the slide: Vuse, Smoke, Puff, Elf Bar, Vozol, IQOS, Glow. All of them are defined as non-combustible products. And for the rest of my talk, I will be mentioning them as e-cigarettes. In the survey, we have experimental and non-experimental modules. In the non-experimental module, we have conventional questions asking about individuals' use of the products, the initiation, how much they use, their socioeconomic characteristics, and also we have some knowledge questions about the nicotine products and also regulatory framework in Turkey. I will be coming them in a few slides. We have the experimental part, major part of our study, and I will be coming to that in a couple slides. We conducted a pilot study to make sure everything works. At the end, we had just over 3,000 participants, with almost half of them are non-users and half of them are e-cigarette or cigarette users. We define users as individuals who have consumed at least 100 cigarettes in their lifetime, regardless of whether they quit or not. At some point in our study, we tried the sensitivity of our results to this definition, and we showed that when we decrease the number of cigarettes to be defined as smoker, it doesn't affect our results. For the experimental part, we have 4 conditions, and participants are assigned to these conditions randomly. In the first condition, we have a legal cigarette, and we define that as a cigarette sold legally. In the second condition, we say that the cigarette is sold unrecorded, under the counter. So we define it illegal cigarette in short. Condition 3 and 4 are e-cigarette conditions. The first one is legal, illegally sold cigarettes, and the fourth one, again, e-cigarette, but now it is sold unrecorded under the counter. And then after this is the statement they are seeing. Imagine that you wanted to use a nicotine product, and we say that it is the only product available for you to purchase. And then individuals see either one of these conditions. We say that the product is same in terms of price, nicotine content, warning labels, flavor, as to legally sold cigarettes. And for conditions 2 and 4, we say that the only difference is that the product will be unrecorded and under the counter. So the only thing changing, only two things changing between across the conditions are whether it's a cigarette or e-cigarette and whether it is sold legally or under the counter. Other than that, we make sure they understand that everything, the price and the other properties are same across conditions. And then after assigning individuals to these conditions, we ask them whether they think the product is addictive, whether it causes medical complaints or causes serious diseases, whether the product is socially acceptable, if this is the only product, whether they would use the product or quit, and also we asked among 100 users of this product how many they think will die from serious diseases like lung cancer or heart disease and such. So these 7 questions, the 7 variable will be our dependent variables, outcome variables, and we will try to see if assigning people to these conditions are affecting their perceptions on this 7 topic. I told you that we also in the non-experimental part we have some knowledge questions. We wanted to know their legal framework in Turkey, whether individuals are knowledgeable on that, and also we have questions on nicotine knowledge. So these are our questions. Let me start with the nicotine. We ask whether participants think the nicotine is the substance in cigarettes and e-cigarettes that causes cancer. So we all know that there is this is really there's a misperception, knowledge about this from the literature. We know that even among doctors. So this is false. We wanted to see if they can say this is false. And as you can see, this is the percentage of correct answers, and the correct answers is in average is around 30%. Only 30% of our participants know that nicotine is not the substance in these products that causes cancer. So they failed in terms of nicotine knowledge. And also the top part is showing our questions on the legal framework. We have 6 questions. Principally, we are asking to know whether they know packaged cigarettes, e-cigarettes, hand-rolled cigarettes are legally or illegally sold in Turkey, also flavored ones. And the last 2, whether the possession of e-cigarettes is permitted, and also whether the indoor use of e-cigarettes is permitted. As you can see, most of the wrong. So again, this is showing us the percentage of correct answers, and you can see most of the individuals don't know that e-cigarettes, hand-rolled cigarettes, and flavored cigarettes are illegal to be sold in Turkey. They don't since in Turkey they are they can easily access to these products, and most of the time, especially the young ones, they don't know that the products are illegally sold. And also in terms of other questions, the knowledge is almost around above 85%. And also there is this question is also a little bit different from the these ones. Around 60% of the people think indoor, they don't know that indoor usage of e-cigarettes are not permitted. They think it is permitted to be used indoor. This is also one of the questions that we find that people are not very knowledgeable. So using these questions, we create an index. If they give a true answer, they get +1. If they got it wrong, they get a minus. So if, let me show you. Sorry, I don't have that. So if they give all true answers, they got a 6. And if they give wrong answers to all, they get a -6 in the legal index. And for the nicotine index, it's just a dummy. If they know this question right, they get 1, and if it is wrong, they get 0. This is our empirical model. We have dummies for each condition. Condition 1 that is being assigned to legal cigarette is omitted. And we have dummies for other 3. We are also controlling for whether the individual is a user or not, whether it is a e-cigarette or cigarette. We just define them as users. And we are also controlling for gender, age group, region, income, their own education, and their parents' education. So this is our main results. So again, the omitted category is the legal cigarette. As you can see, people are finding illegal cigarettes as less socially acceptable, and they are less willing to use these products. Also, the usage willingness to use the products for illegal cigarettes are also statistically significantly less than cigarettes. So based on the sample mean, these coefficients correspond to 7% and also 7% less for illegal cigarette and 11% less for illegal e-cigarettes. People are less willing to use these products. So I forgot to tell you this regression is including only users, whether cigarette or e-cigarette, just users. So using these products, choosing to use cigarettes or illegal cigarettes is a choice variable, and it adds some endogeneity to the analysis. But we still think it is important to see whether there is a difference in terms of perceptions between users and non-users. So we wanted to repeat the same exercise, this exercise for non-users as well. And we find that compared to legal cigarettes, individuals find illegal cigarettes are as less addictive, less likely to cause discomfort and disease. These results at first seem surprising. It's hard to explain. But first, as I said, the characteristics that made these people to not use these products maybe the confounding factor for these results. And also from our knowledge questions, we know that non-users are among the least knowledgeable in terms of legal status and also nicotine questions. So we thought maybe this lack of knowledge is driving the results. So in the next exercise, we repeat the same for non-users, but this time we are controlling for legal knowledge and nicotine knowledge. And when we do that, unexpected significant results for the illegal cigarette and also illegal e-cigarette conditions have disappeared. So, as we have expected, lack of knowledge were the driver for those results. But when I show you this one, you might think that it might be the same for users. If I control for users' knowledge, I might lose the results in my main table. So we repeat the main exercise again, this time for controlling for knowledge. So again, users, same experiment, same model, but now we add controls for legal knowledge and nicotine knowledge. As you can see, the main results we talked about in the first table still remains. So users' knowledge doesn't affect our findings that individuals would be less willing to use illegal ones compared to legal cigarettes. Finally, so we have 4 conditions, 2 cigarettes and 2 legal status. We wanted to decompose where this effect is generally coming from. So we combine cigarette conditions and also cigarette and e-cigarette conditions together, and also illegal products together. So if it's an e-cigarette, whether it is legal or illegal, it gets 1, the dummy. Now the cigarette condition is omitted. And whether it is cigarette or e-cigarette, if it is illegal, we assign that 1 as dummy, and at that time being legal is omitted. As you can see, illegal products are perceived as less socially acceptable, and again, individuals are less likely to willing to use these products, and also they have more positive feelings about e-cigarette. They think it's less likely to they are less likely to cause serious diseases, and they would be less willing to quit if this is the only product available to them. So we can deduct this one from the first table, but seeing that in this like a compact version highlights the importance of legal status on the consumer perceptions. So to conclude, we show that the legal status of tobacco products significantly influence consumer perceptions. Users view illegal cigarettes and e-cigarettes as less socially acceptable, and they would be less willing to use these products than legal ones. Uh, we think these findings underscore the complexity of tobacco regulation. These bans may reduce the appeal of these products. They apparently make these products perceived as more risky and less socially acceptable. But at the same time, these bans often drive consumers to illicit markets. So effective policies, public health policies should address both of these issues at the same time. And also enhancing public knowledge about the health risks associated with these products is very significant. We think these findings are offering valuable insights for policymakers. Thank you for listening.
Thank you very much. As we transition to the next speaker, I wanted to remind all the attendees that if you have any questions, you can submit them to the question and answer part of the Zoom, and we'll try to answer them at the end of the entire webinar. And actually, if we don't have time to get to that, we'll try to answer them additionally on that. So with that call for the questions and answers, now I'll turn back to the next speaker.
Thank you, Mr. Donald. I think this is okay. Hello everyone, I am Yenal Yiğit from Economic Research Agenda Association and also TOBB University. I will present our another paper titled The Choice Between Cigarettes, Roll Your Own, and E-cigarettes and Quitting, Evidence from Discrete Choice Experiment. This is our disclosure note, same disclosure notes. The purpose of our research is to investigate the choice of adult consumer in Turkey about combustible and non-combustible nicotine products and the trade-off that they face making a choice between these products. We investigate the role that nicotine products attributes, such prices, legal status, and flavor availability, and we try to find that what is the effects these attributes play in consumer choices. Because of this purpose, we collect the data from online survey among adults whose ages 18 to 65 in Turkey. There are 2,205 participants in this survey. In our survey, there are 3 parts. One of the parts is about product consumption, demographics, and actual price paid per pack questions. Second part of our survey is about discrete choice experiment model. We ask to just only for smokers or vapors participants, and we give them 4 options, and these 4 options: cigarettes, electronic cigarettes, roll your own cigarettes, and quitting. And these products had 3 attributes: price, legal status, and flavor availability. And respondents were asked to state which these options they would choose. So we can collect 12 different choice sets, and each presented twice, for once for today and the other for 6 months later. So at the end, we gather total 24 choices per respondent, and the attributes varied across choice sets. And the last part of our survey, post-DC questions, which are knowledge level of participant regarding cigarettes like products and the current legal environment in Turkey, perception regarding various nicotine products, health risk, cost, practicality, or other overall favorability for usage, and knowledge about nicotine addictive or not, something like that, and motivation for usage, perception of health benefits, cost effectiveness, practicality, indoor usability, customization, something like that. This is the our descriptive table for every user. Cigarette roll your own and vapors. First row shows us the 6% of participants is triple users. They use e-cigarettes and roll your own cigarettes and vape electronic cigarettes, nicotine-like products, and more than half of participants use just cigarettes, and 12% of participants use roll your own cigarettes, and just 1% of participants just only use e-cigarettes. The last three rows shows us two of the products using percentage. The another table shows that many of participants is daily smoker, and more than half users has high school and above degree. This is the DC model screen. You can see that there are four products: packed cigarettes, roll your own cigarettes, e-cigarettes, and HTP or quit. For packed cigarettes, there are three price level: half of the actual price, and twice of the actual price, and one level of sale type for packed cigarettes, which is legal with bandroll, and two level of aroma flavor attributes for packed cigarettes, which are tobacco flavor and menthol flavor. For roll your own cigarettes, the price is just one level, which is equal to 25 Turkish liras. And sorry about that. There is one sale type which is illegally sold, and one flavor level which is tobacco aroma. For e-cigarettes or HTPs, there are three price level, which are 20 Turkish liras, 40 Turkish liras, and 80 Turkish liras. And three level sale type are in here, which are legal with bandroll, illegal sold, and strictly banned. And two level of flavor, which is tobacco flavor and variety of flavor. This is the actual DC model screen. We give our participant this screen, and we want them to choosing one of these options for different attributes. This is our empirical model. This is the utility model. We control the alternative specific constant for products and price, flavor, and legality. And we also control the age, region, gender, and education. And we estimate this empirical model with a panel mixed logit choice model. This is the choice result. What you can see that almost 60% of participants choose combustible cigarettes, and almost more than 15% of participants choose electronic cigarettes also. And just 3 or 4% of participants choose quit after this experimental screen. This is our panel mixed choice model results. You can see that first column shows us for all result for all people. Second column results for 18 to 30 ages people, and the last one is the last column shows us for older people's results. And price has a negative and a significant effect for all people, and young adult people and older people, which mean when the price increases, the probability of choosing these products is decreasing, and it's for all people. For the flavor level, base level is tobacco aroma, and for all people, menthol flavor is statistically significant and negative effect. But for young adults, it's not statistically significant. For older one, significant again. But interestingly, various flavors statistically significant effect for young adult and positive. If we see the legality, this is the base level is legal with banderol. Illegally sold compared to legal product, illegally sold products negative effect for all participants and older participants, but positive and statistically significant effect of for young adults. Besides that, compared to legal products, strictly banned product also a negative and statistically significant for older ones and all of the participants. This is the alternative specific constant results. You can see these results bottom of the fourth rows. You can see that for all column of cigarettes, significant and positive. So we can see that the cigarette has more benefits than other products and quitting. This is the alternative base variable is quitting. So we can say that cigarettes has more benefit than quitting, and these coefficients higher than the other products coefficient, such roll your own coefficients and electronic cigarettes coefficients. So we can say that the cigarettes has more benefits than other products. when we see the roll your own results, for young adults, this coefficient is not statistically significant. But for older ones, this is the significance also, like cigarettes results. We can say that roll your own cigarettes has more benefits than quitting. And when we see the electronic cigarettes results, these results, all results are significant and positive. So we can say that electronic cigarettes has more benefits than quitting. This table shows the willingness to pay. For the first rows is Turkish liras, and bottom of that is convert to the dollars with our exchange rates. Shortly, on average, respondents are willing to pay 14 Turkish liras 14 Turkish liras less for menthol flavored products for all users, and 17 Turkish liras less for menthol products for older ones. But on average, young adults respondents are willing to pay 12 Turkish liras much for various flavors, various flavored products. And additionally, you can see that legal salt and strictly banned is minus 16 and 23 for all participants, and for older participants, but it's different for young adults participants also. In a conclusion, alternative specific constant term positive and statistically significant for all participants for 3 products. And we can say that the cigarette has more benefits than other products, although the coefficient of electronic cigarette is seen to be close to the coefficient for roll your own, but it's seen that it's just a little bit higher. And another conclusion, price is negative and significant. Menthol flavor is negative and significant, but is not significant for young adults. And the coefficient of illegal sold and strictly banned product is negative and significant. If the product is banned or unregistered, it's less likely to prefer than legal products. Thank you. I think we use the time. We can use the time.
Yes, thank you very much. Very interesting talk. I'll remind the audience that if you have any questions and answers, you can still submit them. And Professor Kenair covered one of the questions that came in online, so we don't really need to talk about that again. It was about, well, the legal status of heated tobacco products in Türkiye. But I'll quickly ask, we only have a few minutes, but I'll quickly ask the last speaker. I mean, the really it's very reassuring as an economist, of course, to see that higher prices affects demand in the way we think that it would. And this, of course, would suggest that taxes could be a tool to reduce any of the use of any of the products. And of course, that might also suggest the use of risk proportional taxation to try to get people to use the safer products, the e-cigarette products. But that's not the main focus here. Since e-cigarettes are illegal, what really struck me, of course, and I'm sure you've been thinking about this, is the unexpected sign effects of illegality among youth on that they apparently see these products being illegal as a positive attribute. They actually like this. Do you have any discussion of what that might mean?
The electronic cigarettes is illegal in Turkey, and actually, electronic cigarettes is most common in the young people. For example, in university, our students use maybe more than half use electronic cigarettes, but this is the illegal products. This they can buy with on internet or illicit market actually. So they don't know the legal electronic cigarettes. Yes, we give the story. Yes, this is the legal electronic cigarettes, but in their minds, they don't know any legal electronic cigarettes in Turkey. Maybe this caused these results, I think.
Yeah, I mean that might make some sense. There may be some additional analysis you can do with your data to try to figure that out more. I wanted to give the chance of any of the other panelists to say anything. Any quick comments or questions for either of the speakers, or if the previous speaker wanted to also mention anything.
Yeah, I would like to also thank the panelists for today's session. It was it's always, useful to review, even though you were throughout the studies. And also, I personally found it very interesting that young people in Turkey would like to smoke e-cigarettes, while at the same time, some of them don't know that they're illegal, but they are still consuming. And if they knew they were illegal, they would consume more. So this is kind of tricky. And I was, as a qualitative researcher, a previous qualitative researcher, I would like to, conduct some further interviews on this as well. It's very interesting.
Yeah, that's great. It's always great when research spurs new questions. I mean, that's how science progresses. And
yeah, I think so.
Well, with that, I think we're out of time. I don't see any questions in the Q&A box. So I'll just thank all the panelists for great talks. And I really learned a lot, and I look forward to hearing more about this research. Thank you very much.
Thanks for the opportunity to present our research. We appreciate it. Thank you.